All right, here we're going to look at the quadratus lumborum, which is parallel fiber orientation, and it's a four-sided muscle. So when you think of quadratus in that respect, we're talking about a four-sided muscle like that. Lateral flexion of the spine and this to the same side, and then also pelvic tilt. It's going to help with that. You can also see how they've got different colors for the different parts of the vertebral column. So we have C1 through 7, it's going to be the cervical vertebra. T1 through 12, we've got the thoracic vertebra. And then we have the remaining lumbar vertebra. There's 5 there. You can see the sacrum and the coccyx down here, the little fused coccyx. You can see the sciatic nerve coming down from that sacral plexus down there. You can also see some of the very important ligaments of the pelvic structure. Here we've got our posterior sacroiliac. You've got your sacrotuberous going to the ischial tuberosity, and you have your sacrospinous going from the sacrum to the ischial spine. Okay, now let's look at the anterior view of some of these structures. So here you can see the quadratus lumborum. You can see all of these discs between the adjacent vertebra. There's your iliolumbar and your anterior sacroiliac portion of the ligament. You can also see in here a little bit better your sacrospinous going from the sacrum to the ischial spine. You see a lot of those nerves coming out. Here you've got your psoas major and your iliacus together. The iliopsoas are your hip flexors. See the pubic symphysis down here. Now one thing I want you to take special note of. We talk about a ruptured disc, slip disc, bulging disc, all those different terms. A lot of times practitioners use those interchangeably, and especially as laypersons we use those terms interchangeably. What that is referring to is a failure of the outer surface of your vertebral discs, which are in between each adjacent vertebra. So if we're looking at vertebra, disc, vertebra, we call that a vertebral unit. So 2 adjacent vertebrae with their disc in the middle. When we have a failure of one of these discs, that's when the annulus fibrosus, the outer layer, has a tear, a rip, gets weakened, and the nucleus pulposus, which is the inside, it's a little squishy, kind of like the jelly in a jelly donut. When that jelly gets dislodged, it might get shifted. It might actually come all the way out. So if you have so much compression that you literally squirt the jelly out of the donut, you can see that that's going to result in a decrease in the distance between the adjacent vertebrae. So think about flattening this like a pancake, and instead of having this much distance between the adjacent vertebrae, that becomes very compressed. What do we have all around here? All these nerves. When you have that compression, you're going to have inflammation, you're going to have a lot of squeezing going on with those nerves. Here we see where we've had a full rupture. This is representing the pulposus coming out of that annulus fibrosus, and you see what happens in response to all of that added pressure. You see that you get bone spurs. You get all types of issues. Imagine this mushing around in all that soft tissue in your back. Extremely painful, one of the main reasons that people have chronic low back pain. But that's exactly what we're talking about when we say a ruptured disc. Literally, the annulus fibrosus is torn in some way, and the jelly in our donut gets squished a little bit. So that's the nucleus pulposus coming out of the annulus fibrosus, which has failed.